Hey guys, I'm Nicole. Today I'm going to be showing you how to do a full head to toe assessment on your patient. So first, it's really important you want to practice hand hygiene. Make sure that you have clean hands before touching them. Then what we're going to do is we're going to go introduce ourselves to our patient. Hi, how are you today?
Good, how are you?
Good. My name's Nicole. I'm going to be your nurse. So very important that we close the curtain for privacy. And can you tell me your full name and date of birth, please?
Caitlin Travasso, 7/16/90.
Thank you. I'm just going to check your wristband. And what time was your appointment today, Caitlin?
2 o'clock.
All right, we are running a little behind, and I apologize for that.
No problem.
So my patient, as I'm speaking to her, I can tell she is alert and oriented. Times 3, she knows who she is. She knows what time her appointment was. She's using good language. She's dressed appropriately for the season. So I'm going to go ahead and explain to her how we're going to start the assessment. So first what we're going to do is we're going to get your height and weight, BMI, and we're going to do your waist circumference as well. Then I'll bring you back into the room. What we'll do is we'll start at the top, work all the way down, okay?
Sounds good.
So what I'm going to have you do is I'm going to have you step over here to the scale. We'll get your height and weight. And as my patient's walking, I'm going to be watching how she is walking. Noticing her gait. Is she steady? Is she having any difficulty walking? Today she's not. I'm going to have you take your shoes off for me, please, if you would. I'm going to have you step up on the scale and weight. I'm just going to step down for 1 second. And I'm going to have you step on backwards. We'll get your height for you. And I'm going to stand nice and tall. Thank you. You can go ahead and step down. I just want to make sure that you help your patient if they need any assistance. And as she puts her shoes back on, I'm just going to grab my tape measure so we can go ahead and grab her waist circumference. Thank you. So have you put your arms up, and we're going to just wrap this right around the umbilicus. And you want to make sure that you're right there. So we've got her waist circumference, and according to her height and weight, we'll calculate her BMI. Anything between 18.5 and 25 for females is normal, and hers is within normal limits. So now what we'll go ahead and do is we're going to have you go back into the room. I'm just going to have you do a little bit of a funky walk. I'm going to have you do some heel to toe as you take your steps. Thank you. And can you walk on your toes? Great. And how about the backs of your feet? Excellent. Thank you very much. You can walk normally now. All right. So what I'm going to do before I have you sit is I'm just going to have you bend over straight and touch your toes, because what I want to do is I want to check for your spinal alignment. And I'm going to palpate the spine, make sure that there's no tenderness, no masses, anything like that at all. We're then also going to check her hips, make sure that her pelvis is in line, and it is. You can go ahead and stand up for me, dear. Thank you. I'm going to have you sit right back down on the bed. So now what we'll do is we'll test your range of motion. So I'm going to have you just follow what I'm doing. So stick your hands straight out. Can you rotate your wrists? Great. Can you fold your arms up and down like this, like you're curling? Perfect. And now I'm just going to have you do arm circles for me. Great, thank you. So now let's do the same with your ankles. Can you turn your ankles one at a time? Awesome. Can you kick your legs out one at a time? Awesome. Great. And then what I'm going to have you do is I'm just going to have you step on my hands right here, 1 foot at a time, like you're stepping on a gas pedal. Great. And push back up on them for me. Thank you. I'm going to have you push against my hand here with your leg. Great. And this one as well, please. Thanks. And we're going to stick your arms out again. And I'm going to have you push down against my arms. And we're going to do a little flip and push up. Awesome. All right, so now what I'm going to do is I'm going to go ahead and put gloves on. And I'm going to ask my patient to please take her hair out of the bun that it's in, because I want to be able to inspect her scalp. We're looking for any kind of lice infestations, lesions, any balding patterns, just making sure the hair is growing in a proper way. Great, thank you. So like I said, we're just going to sift on through. We're looking for any kind of lumping, any scarring. And her hair appears very clean. There's no abnormal growth patterns. Everything looks good. So then what we're going to do is I'm going to start with her face. I'm going to start and I'm going to palpate her along her sinuses. Are you feeling any tenderness?
No.
Great, and then we'll work to her ears. So we're gonna palpate the pinna from the top all the way to the lobes, just being careful. And then if we had an otoscope, what we would do is look inside of the ears by pulling up and back on the pinna, checking the tympanic membrane, making sure that there isn't any kind of inflammation or redness. And there's no drainage either, so that looks good. So now what we're gonna do is I'm gonna check your eyes. So I wanna make sure that my patient doesn't have any kind of inflamed conjunctiva. They look pink and normal. The sclera, which is the white of her eye, is also white. I'm noticing she's got round pupils and her iris, both her iris bilaterally look fine. So now what I'm gonna do is I'm just gonna shine this light. I'm gonna have you just look at my nose while I do this. So we're going in with the light and I'm looking at her left eye. Again on that eye, we're gonna look at her right eye. Perfect, and we're making sure that as the light goes in, that the pupils are constricting, and when the light comes out, they're dilating. So then we're gonna do it again on this side. Just keep looking at my nose. Awesome. Great. And so now I'm just gonna have you follow the tip of my pen. We're gonna go up. So her extraocular movements are good. I'm gonna have you follow me up. Perfect. Awesome. And then finally, I'm just gonna move this pen light a little bit closer and you'll feel your eyes turn in, okay? Just keep following it. You're doing a great job. Awesome, so I have determined that my patient's pupils are equal, round, reactive to light accommodations, and we're gonna go ahead and move on to her nose. So first what I wanna do is I wanna use my pen light and look up into her nostrils and make sure that there's no drainage or no signs of any kind of lesions or anything. Then we're gonna check to make sure she doesn't have a deviated septum. So what I'm gonna do is I'm gonna close off this nostril. I'm gonna have you gently blow out. Great, and gently blow out here. Great job. So there is no deviated septum. She's not having any difficulty breathing out of those nostrils. Then what I'm gonna have you do, excuse me, I'm gonna have you open your mouth. We're gonna get our tongue depressor out. Which is not easy to do with gloves on. All right, Miss Caitlin, can you just open up and say ah for me nice and loud? Stick your tongue out. Great. So I noticed as I pushed down on her tongue, her uvula went up and back. I'm gonna have her open her mouth one more time. We're gonna check those mucosal linings in her mouth, make sure that they're moist and pink and that she doesn't have any missing teeth or any teeth that may be broken. And everything looks great, so we're just gonna throw this away. All right, so now what we're going to do is I'm going to have you just stick out your tongue for me. Move it left, move it right, up and down. Perfect. Can you puff your cheeks? Awesome. And I'm gonna have you smile, frown, wrinkle your forehead. Awesome. And puff out your cheeks one more time. Excellent. No difficulties? I didn't see any either. So now what we're gonna do is we're gonna go ahead and we're gonna check her lymph nodes. So we're gonna start up here. She's got her pre and her post auricle ones. So we're gonna feel over here, make sure that we're not finding any that are swollen at all. And we're gonna move to the submaxillary, excuse me. Move back, we're gonna get down the neck here, and then we're gonna go to our suprascapular, make sure that she doesn't have any there, and she doesn't, so that's good. So next what we're gonna do is I'm gonna have you just shrug your shoulders for me. Excellent, so that looks good. And then I'm also just gonna feel down her arms, just make sure she's not having any kind of swelling or she's not having any kind of masses or tenderness. Any pain at all?
Nope.
No? Great, scale of 0 to 10, no pain at all, right?
0.
I'm also gonna check her capillary refill, making sure that she's got the refill within less than 3 seconds, which she does, so that's great. So next step that we're gonna do is I'm gonna go ahead and I'm going to view her anterior and posterior thorax. So from what I can see here, she doesn't have any kind of swelling or anything. There's no lacerations, lesions, anything like that. What we're gonna do is we're gonna go ahead and we're gonna check in the back, make sure the same thing. And we're also gonna go ahead and we're going to palpate to make sure that everything's okay. Are you having any pain or tenderness as I do this?
No.
Great. And
Can I have that elastic?
Yes, you can. Okay, and a cooperative patient is always a great patient. All right, so then we're gonna go ahead and do the same thing in the front, and we're just gonna palpate, make sure she's not having any tenderness. Am I causing you any pain or anything?
No pain.
No?
No tenderness.
Great. All right, so now what we're going to do is we're going to test her tactile fremitus. I'm gonna start in the front since I'm here. I'm gonna have you say 99 as I place my hands on you.
99.
Great, so you should feel the vibrations. And as you work your way down the patient's back, the vibrations are going to decrease. So go ahead, 99.
99.
Great,
99.
great.
99.
Thank you. I'm gonna have you take a deep breath in. We're gonna check and make sure that you're not using any accessory muscles with breathing. And for thoracic expansion, take a deep breath. Thank you, so that's good. All right, so now what we're going to do is we're going to start, excuse me, with her respiratory system. So what we're gonna do is we're going to listen to our breath sounds from the front and then in the back as well. So you wanna make sure as you're doing this, you're not over any kind of bone at all. I'm gonna have you take a deep breath in. Great. And for the purpose of this video, I'm gonna continue over clothing, but normally your patient, you would do this on bare skin with a Johnny on. So go ahead and take a deep breath. Thank you. Great, another one. And another one. Excellent, and over here. Great, and one more. Thank you. So now we're gonna move to the back. All right, and I'm gonna have to take one more deep breath in. Thank you. And another one. Great, and another one. And another one. Thank you. And another one. And another one. Awesome. Deep breath. Great. Excellent. So from what I can tell, there's no rales, no rhonchi. She's not having any wheezing, and her breath sounds are clear. So for our next step, what we're going to do, before we lay our patient down, we're going to check her jugular vein here, just make sure she's not having any JVD at all. So I'm gonna have you turn your head to the side, and we're gonna look at that. Excellent, and I'm gonna have you turn one more time. Thank you, and that looks good as well. So now what we're gonna do is I'm gonna have you sit up here at a 45-degree angle. Excellent. And while my patient's in this position, I'm just gonna remove her socks and her shoes just so that I can get to her foot so that she can, we can assess her pedal pulses.
Sorry for the unmanned pedicure.
Oh my goodness, no, it's okay. Thank you. I'm just gonna put these down on the floor for you. Alrighty, so now what we're gonna do, now that we've listened to her breath sounds, we're gonna start working into the cardiovascular system. So what I'm gonna have my patient do is sit at a 45-degree angle. Before you lay your patient, you wanna definitely ask if they're gonna have any difficulty with laying flat. But for now, we're just gonna assess her pulses and all of her different pulse points. So we're gonna start with her temporal pulses right here, and they are equal bilaterally. Then we're gonna one at a time, because we don't want our patient to pass out. We're gonna check her carotid pulses. And bilaterally, those are equal as well. Then we'll move down to our brachial pulses right here. And those are equally, they're bilateral equally. And then what we're gonna move to is our radial pulses here. All right, they are equal bilaterally, and our ulnar pulses, also equal bilaterally. The femoral pulses are located in the groin, but for the purpose of this video, we're gonna avoid them. Then we're gonna move to the back of the knee for her popliteal pulses. Again, we have equal bilaterally. Then we're gonna move to the back of her ankle right here for her dorsalis tibialis pulses. Those are equal bilaterally, and then dorsalis pedis. so those are all set. Also, while I'm down here, I'm gonna check my patient, make sure that she's got capillary refill in her toes, and she does, so it means she's got some good circulation. She has no edema in her legs. If she did, we would assess for pitting edema, but because she doesn't, we can move on. And Caitlin, if I lay you flat, are you gonna have any difficulties breathing at all?
Not at all.
No? Great, so what I'm gonna do is just lower the head of the bed for you. You comfortable? Mm-hmm. Excellent. All right, so now what we're gonna do is we're going to listen to our cardiac sounds. And what we're gonna do first is we're gonna listen with our diaphragm, and then we'll go back and listen with our bell. All right. So first we're gonna start right here. Actually, we're gonna lift you up first, because there we go. Sorry about that.
It's okay.
All right, so what we're gonna do is we're gonna start here. And what we're listening for is the aortic, and that's located at the right sternal border at the second intercostal space. And then we're gonna move over here, also staying in the second intercostal space, but on the left sternal border, and that's going to be for our pulmonary valve. We're gonna move down a little bit. Again, for the purpose of this video, we're doing it over clothing, but you would normally do this right on bare skin for your patient. So after we've assessed these two, we're gonna go to the Erb's point, which is at the third intercostal space on the left sternal border. And then we're gonna come down here and listen as well. We're gonna go to the apical pulse. We're gonna listen to that for 1 full minute, and that is at the fifth intercostal space, the midclavicular line. All right. And now that a full minute has passed, we're gonna go ahead and tell her that her pulse, her apical pulse was 72, and there were no abnormalities noted. And we're gonna go ahead and turn the stethoscope around and listen with the bell. And we're just gonna work in the reverse order that we went. And although we tested for JVD earlier with the pen light, we're just gonna go ahead and listen bilaterally to our carotid pulses. And everything sounds clear right there for her heart sounds. So now what we're gonna do, Caitlin, is we're gonna go ahead and we're gonna lay you flat. Have you had any nausea or vomiting in the past week or so?
No.
No abdominal pain?
No.
Great. Do you mind if I just lift your shirt a little bit?
Go ahead.
Great. So now what we're gonna do is we're gonna assess her abdominal region. So first what we wanna do is we wanna listen to all of our bowel sounds. We're gonna start in the right lower quadrant, and we're gonna work our way around. What we wanna do is we wanna hear between 5 and 35 gurgles. If we don't hear any kind of sounds in the regions, what we're gonna wanna do is listen for a full 5 minutes in each quadrant. And as we hear bowel sounds, we are able to go ahead and move on to the next quadrant. And again, bowel sounds are noted there. So now, Caitlin, what I'm gonna do is I'm just gonna start with some palpations. I'm gonna start with a light palpation, and then we're gonna move into a deeper to get into those organs. Because the patient doesn't have any kind of rashes, swelling, any kind of injuries, we can go ahead and start this. So what we're gonna do is we're gonna percuss each quadrant, and that's all set. So now what we're gonna do is we're gonna do some light palpations, and just let me know if I'm causing you any pain or discomfort, okay?
Okay.
No pain or tenderness at all?
No.
Great. so I'm going to start my deep palpation. Just let me know if you're in any pain at any time, okay?
Okay.
Still feeling okay?
Yeah.
Excellent. So that is all set for you. So we're going to go ahead and we're going to raise the head of your bed back up. Is that a comfortable position for you?
Perfect.
Excellent. Do you have any questions at all before the doctor comes in?
No.
Great. Well, it was nice to meet you, Caitlin. Have a great
Thank
afternoon.
You too. Thank you.
You.